see scenes like this before, natural disasters, but the threat this time is COVID-19. Across the country, many deciding to stock up. This as the death toll in the U.S. rises, and officials across the country warn everyone needs to be prepared. New travel alerts now issued. Americans urged not to visit Italy and South Korea. So many now asking what they should do. We'll tell you what you need to know. Good evening, everyone. I'm Lindsay Davis. Thanks so much for streaming with us. We certainly have a lot to get to tonight, but we begin with the rising death toll here in the United States due to the coronavirus. 6 people in Washington state are now dead, with King County, which is where Seattle is located, declaring a state of emergency, revealing it has 14 confirmed cases, many fearing the virus has been circulating there for weeks. Across the country, there are at least 101 confirmed cases of COVID-19. Test kits are being circulated, but there's concern that it is too little too late. With the lack of availability and many patients not showing any symptoms, the path of the spread of the virus is uncertain. Testing for a vaccine is underway now in many countries, and while public health officials scramble, so are nervous members of the public. Many spending this past weekend clearing out shelves at their local stores, preparing for shortages and severe disruptions to daily life. We have full coverage of all the different angles, but we begin with the spiking cases here in the U.S. Kaylee Hartung leads us off.
Tonight, a growing emergency outside Seattle. The death toll from the coronavirus climbing to 6 in Washington state.
The risk for all of us of becoming infected will be increasing.
4 of those victims lived at this nursing care facility, now the center of this outbreak. Colleen Mallory's 89-year-old mother, Peggy, who suffers from dementia, is a resident.
You know, if she gets sick, she's going to be gone.
Colleen got to see her mom today, but fears she's been exposed to the virus.
They wouldn't tell me anything about a roommate who has been removed from the facility. And my mom's been in the room with her for all this time.
New research suggests the virus has been quietly spreading here for weeks, often by people without symptoms. Across the country, the number of cases climbing to at least 100 across 13 states. Today, Travis Air Force Base in California releasing about 140 passengers from the Diamond Princess cruise ship after weeks in quarantine. But the mayor of San Antonio declaring a state of emergency, moving to block any evacuees quarantined at nearby Laughlin Air Force Base from entering the city. The mayor slamming the CDC for releasing a woman hours before a final test for the virus came back positive.
I find it totally unacceptable that CDC would release a patient prior to receiving all test results and potentially expose the public to this harm. We simply cannot have a screw-up like this from our federal partners.
That infected person visited a hotel, a mall, and a food court before being put into isolation. New York State hopes to be able to test up to 1,000 people a day after announcing its first case in Manhattan. A 39-year-old healthcare worker who returned from work in Iran is now self-quarantining at her home with her husband. Officials are reaching out to fellow passengers on her flight and her livery cab driver.
There is no doubt that there will be more cases where we find people who test positive. We said early on, it wasn't a question of if, but when. This is New York. We're a gateway to the world.
The city now disinfecting more schools, buses, and subways. In Rhode Island, this high school is closed and 38 people under quarantine after a student and faculty member tested positive for the virus following a school trip to Italy. And as the virus spreads, Americans from coast to coast taking no chances, braving long lines to stock up on supplies, finding some shelves bare.
And Kaylee Hartung joins us now from Washington State. Kaylee, what are you learning about the spread of the virus in that nursing home there?
Well, Lindsay, now that there are 6 confirmed deaths in Washington state, we know 4 of them were once residents here at Life Care. And of the more than a dozen confirmed cases currently in King County, the majority of those also residents here at Life Care. This was the worst kind of perfect storm at this nursing home. A nursing home, such a vulnerable population for any infectious disease to spread, and we don't know how the virus infiltrated this nursing home. Health officials here saying we know we are dealing with community spread. When you think about the revolving door that a nursing home is, from the residents coming in, their family members and visitors, to healthcare workers and other health professionals, again, it's just that worst kind of perfect storm. We know About 50 people inside Life Care are still being monitored, and dozens of first responders and healthcare workers, they are in quarantine tonight. They're being monitored for symptoms as well.
And Kaylee, as you mentioned in your story, officials fear that the virus has been going around undetected potentially for weeks. What's the mood like there? How concerned are people on the ground?
Well, Lindsay, all you have to do is go to the nearest supermarket in this county to see the fear that this virus has created. Shelves are clearing out. Everything from antibacterial wipes to toilet paper, water, non-perishable food items, even to pet food. Now, while health officials are urging that caution and calm, they say they know the number of confirmed cases will continue to rise. I go back to the conversation I had with Colleen Mallory, the woman whose mother is here at Life Care. It was interesting to hear from her perspective, of course, her concern for her mother here at this nursing home, but also for her to say she knows she's been exposed to the virus just by going inside to visit her mom. But she said, I'm healthy. I'm not who I am worried about in this case. We go back to those most vulnerable populations, the elderly, anyone with a weakened immune system. Remember, 80% of these cases are mild, but also that's how this disease has continued to spread. Those people who are sick and don't even know it.
Right.
Lindsay.
Kaylee Hartung for us. Thanks so much for joining us tonight, Kaylee.